3 chaplains.
Being able to kind of re-understand what it's like to be present with someone, even when we're distant.
3 hospital systems.
And we'll get through this.
3 examples of the men and women called to connect patients with their loved ones separated by a pandemic.
Well, COVID-19 changed everything.
Bill DeLong is Director of Spiritual Care for Legacy Emanuel Medical Center, Randall Children's Hospital, and the Legacy Oregon Burn Center. In 37 years as a chaplain, he's never experienced anything like this.
And sometimes it's us on the other end of the phone looking through the glass door, talking to a family member and describing what the scene looks like. That is, if their loved one's unable to speak because they're on a ventilator.
Only during patients' end-of-life moments do Legacy's chaplains gown up in personal protective equipment to meet with them in person. It's a sacrifice to preserve their limited supply of PPE, one of many emotional sacrifices made daily.
Watching nurses that I've worked with for years and years being really emotionally distraught.
It's one reason chaplains dedicate 1 shift a day to care for the hospital staff.
All of those people that are caring for patients, it just takes a toll.
One of those stresses, worrying about patients' isolation from their loved ones.
People are wondering, how is my loved one doing? Are they okay? Are they going to survive? And often if people can't see with their own eyes how their loved one's doing, they're feeling very lost and very confused.
Michele Todd is lead chaplain at Peace Health Southwest Medical Center. Every day, she and her staff call loved ones to connect with patients.
So many family members have said, thank you so much for reaching out to us. We wouldn't have known what to do to be connected with our loved one.
Not every patient that needs spiritual care is isolated in a hospital room. Chaplain Andrew Turner speaks with patients both in person and remotely who are part of the VA Portland healthcare system. He says being a good listener is key, but it can be harder than it sounds, especially now.
We want to be helpful. We want to talk about all the great things that are on the other side of this pandemic or the things that we have to be thankful for. And oftentimes when we do that, we're taking care of our own anxiety.
Advice he offers to anyone trying to care for loved ones, whether they be sick, worried, or stressed.
Maybe uncomfortable to listen to. Like nobody likes to see another person weep or to see another person talk about how hard life is.
And to those called to do just that, we thank them. Catherine Cook, KGW News.